All right. Hi guys. Very good evening to all of you. Welcome to our today's YouTube session. In continuation with what we have discussed yesterday, today I shall be talking about part 2 of the high yield MCQ revision session. And if you have attended yesterday's session, you know that we are actually discussing the clinical based scenario, and in between we also have some smaller topics as well. Okay, so let me start this session very quickly, but before that, a quick confirmation from all the students, those who are live right now. Please let me know if I'm clearly audible and visible to all of you guys. If everything is fine now. For all the students, those who are new here, you can reply to the comments here in the comment section in the live chat option. There's a live chat option which is available, which you guys can utilize. Sorry. All the students, those who are live, please give a quick confirmation so we can start immediately. Am I audible and visible to all of you guys? Hi everyone. Okay. All right. So a quick reminder to all of you that you are subscribing to Unacademy. Please do not forget to use the code PHARMA10 to avail a 10% off in your subscription. You can use the code to buy an Unacademy Iconic subscription or a plus subscription where you will have all the benefits of Unacademy. Okay. Then quick announcement that I am having another one, that if you're subscribing and if you're buying a 1-year subscription, then you'll be getting a 1 year with this 1-year subscription you'll be getting the notes, the NEET PG notes of all 19 subjects absolutely free. And in addition to everything, you can use the code PHARMA10 or you can even use Dr Siraj Live. This is also code, a live code and also working code. Dr Siraj Live or PHARMA10, both the codes are working. PHARMA10. Okay, this is the plus subscription where you will have all the benefits, live classes, recorded session, question bank, everything. And Iconic May you will have benefits of both Unacademy and Prep Ladder both. Okay, these are some rituals that are being followed on the platform, like educator curated test series subject wise, all India mock test, NEET PG that was conducted in 26, then it was today FMGE 2022 grand test that was conducted. Then some new batches that are being launched, a previous year question batch targeting NEET PG, the one that is going to be conducted in the upcoming May, right? So in this pharma will be covered by me. There will be straight 8-hour PYQ session in 2 days, that is 4 hour in on 7 and 8. So in this one, if you guys are looking, all the plus subscriber, May 7 and May 8 ko 2 session will be there on each of these days. So 2 session on May 7 and 2 session on May 8. Okay, 7 and 8 May ko there will be pharma for all the plus subscriber. And FMGE 2022 comprehensive batch. So it's like a crash course that will be finished in 2 months. From March 2 to May 2 it will be conducted. And in this also, I believe pharma is, I'll be taking the pharma for our FMGE students targeting the June. And FMG Focus 2022, all the students, those who are targeting December, for the December 2022 batch, this is something that you are looking for. And in here also, I'll be taking care of the pharma. Next 2023, another 1-year batch course, here also pharma will be covered by me. And these are the other educators that are there in your batches. Then another batch for the May batch, 2nd March ko another batch course is starting, NEET PG 2022 all educator revision batch. And after this, I'll be starting our session today. I hope all of you guys are ready, and we had to, we had that short introduction about the upcoming classes, upcoming courses that you guys are actually looking forward. And if you have not subscribed yet, go ahead, subscribe, and you can use the code PHARMA10 to avail a 10% off in your overall subscription in addition to everything. All right, so I'll give you your first case. Go ahead, please. A 6-year-old child started on an antimicrobial agent by a quack in a village. Later, he complained of limping and difficulty in walking. The orthopedician diagnosed him to be a case of due to tendinitis. Which of the following agent might be most likely cause of this? So it's very, very straightforward, easy question, but presented in a form of case base. This question has been asked directly previously as well. So go ahead, guys. Which drug will be having this kind of problem? Is it ciprofloxacin, doxycycline, erythromycin, cefpodoxime? all the students, those are live. Go ahead. Everyone who is live. Yes. Very well, Sai Charan. That's very nice. Very nice. So I believe it's very easy question because it has been asked previously as well. We all know, guys, that fluoroquinolones are actually associated with tendinitis. They are associated with tendinitis. Fluoroquinolones are also causing arthropathy. They damage the growing cartilage and tendon. Therefore, this is one side effect that is noted with them. Remember, so drugs among these, which is fluoroquinolone, it is none other than ciprofloxacin. A couple of points about ciprofloxacin that I would like to tell you, that it is a highly effective drug in pseudomonas as well. You should know orally a drug among fluoroquinolone highly effective. It is also a highly effective drug in prophylaxis of anthrax. However, if the examiner is going to ask you drug of choice for anthrax, you will be going ahead with the penicillin. Ciprofloxacin, remember, it's also having drug interaction, so it's a potent enzyme inhibitor. It's a potent enzyme inhibitor, do remember that. Okay. Doxycycline is a tetracycline. It does not have any limping or arthropathy like side effect. Undoubtedly, doxycycline is having other side effects like liver failure and hepatotoxicity, renal toxicity it can cause. And then they will also be causing teeth staining. They will be causing that. Erythromycin, the macrolides that can cause nausea, vomiting, hypersensitivity reaction. It can cause QT prolongation and diarrhea because of the motility receptor agonistic property. Cefpodoxime, one of the third generation cephalosporin. So they are also not associated with the shown side effect. So I hope this is a pretty clear question. Yes, we can take the next one. So very quickly we'll talk about these MCQs that are available in the clinical base. In a patient with history of epileptic disorder, a drug was started which reduces glutamate release. It reduces glutamate release by inhibiting voltage-gated sodium channel blockade. Which anti-epileptic drug does not act via sodium channel blockade? As simple as that. Which of the following anti-epileptic drug would be having this kind of property? Go ahead, please. Which anti-epileptic drug? Start answering. Is it vigabatrin, carbamazepine, is it lamotrigine, is it phenytoin? Very well. So as I can see, some of you are marking carbamazepine. Okay. Other students, please. Sai Charan is marking A, vigabatrin. Others are marking lamotrigine. Very well. B. Okay. Majority of you are in favor of B, carbamazepine. What is the mechanism of action of vigabatrin, guys? It is one of the GABA transaminase inhibitor. Vigabatrin is one of the GABA transaminase inhibitor. Do remember this. This GABA transaminase inhibitor, it is going to actually increase the level of GABA at the synaptic cleft. It is also asked in the 2021 INICT as well, that which anti-epileptic drug can reduce the visual, decrease the visual field. So this is actually causes peripheral retinal atrophy. It is associated with what? Peripheral retinal atrophy, and because of this peripheral retinal atrophy as a side effect, it causes your tubular vision, also given the term as a donut vision. Tubular vision, tunnel vision, tubular vision, tunnel vision इसको बोलते हैं, टनल विजन, डोनट विजन भी कई बार इसको प्रोनाउंस किया जाता है. Carbamazepine, lamotrigine, phenytoin, guys, these are actually voltage gated sodium channel blocker. All of them, they are voltage gated sodium channel blocker, yes. And by inhibiting this, they inhibit the release of the glutamate. But vigabatrin, come on, it's a GABA transaminase inhibitor, no? GABA transaminase inhibitor. And this vigabatrin that we have, it is considered as a drug of choice in a patient with the infantile spasm associated with the tuberous sclerosis, right? Plus, it can also be used in all the partial or the focal seizure. Partial seizure or focal seizure may also it can be used. Do remember that, okay? So I think this was also pretty simple, but some of you could not get this. Go ahead with the next question that we have. In an infected patient with the fungus and virus, the following drug combinations are correct except hepatitis B entecavir, CMV, ganciclovir, aspergillosis, fluconazole, mucormycosis, amphotericin B. Go ahead please for this question. What do you think is not correct? All of you please try. All the students, those who are live, please try marking this. Hepatitis B, entecavir, CMV, ganciclovir, aspergillosis, fluconazole, mucormycosis, amphotericin B. Come on, go ahead. So I think you guys are marking A, C, B. Okay, multiple responses are coming. Right. C. Well, what is the drug of choice for aspergillosis? Then of course C is the correct answer. I am just saving some time here because we have a lot of questions to discuss today. So aspergillosis का drug of choice क्या होगा? What is the drug of choice in aspergillosis? Anyone? Aspergillosis में drug of choice बताइए. Hepatitis में entecavir, lamivudine है ना? Tenofovir we can use. है ना? Tenofovir. These are the agents that we can use actually. है ना? Aspergillosis का the drug of choice is actually your voriconazole. That's correct. That's perfect. Yes. Drug of choice in aspergillosis, guys, is going to be your voriconazole. है ना? So this question was asked in NEET PG as well. And mucormycosis, of course, we can use amphotericin B. Plus, remember, for the mucormycosis, can you tell me which is the first azole that is effective? The first azole that is effective in mucormycosis, guys. Which is the first azole? The name of the agent is your posaconazole. And posaconazole. And then other one that is effective is isavuconazole, not vori. Posaconazole is the first one. Very good. Dr. Reduce Cost and others. No? So posaconazole. In fact, when we had this mucormycosis outbreak after the second wave in our country, we have seen many sufferers of mucor. So for all the, not everyone was lucky enough to get amphotericin B. So everyone who could not get this, we even used posaconazole in those patients as well, and the results were good. They were also recovering with this. In a patient with epilepsy during pregnancy, levetiracetam was started. This agent act by, please go ahead. So rapidly, short and sweet explanation we'll be pushing through so that we could cover more number of questions here. Levetiracetam, now it's considered the drug of choice in epilepsy in pregnancy. So how does it work? Direct sodium channel blocker, direct calcium channel blocker, synaptic vesicular protein inhibitor, or mGlu5 receptor inhibitor. Go ahead please. Short cases. All the students, those are live, please go ahead. Okay, great. So as we can see here, majority are in favor of C, so that is very good. SV2A, synaptic vesicular protein, guys, it actually modulate in a normal scenario. If you see SV2A, it actually modulate your glutamate and GABA release. So whenever they are actually acting, this SV2A, they actually promote glutamate release and they hold the GABA. And when you inhibit it, when you inhibit it, then this glutamate promotion effect will be reduced and GABA will become more and more free. So SV2A inhibitor, we are having drugs that is your levetiracetam, we have the drug that is your levetiracetam, and we also have the drug that is your brivaracetam. Levetiracetam and brivaracetam are the SV2A inhibitor, that is drug of choice also for epilepsy in pregnancy. Okay, so synaptic vascular protein. Now quickly I'll help you in revising this as well. mGlur5 receptor inhibitor, mGlur5, 5 वर्ड्स याद रख लीजिएगा, रिसेप्टर 5 है ना, रुफीनामाइड, यस रुफीनामाइड, mGlur5 receptor 5, okay, receptor 5. Direct calcium channel blocker, no, it is not direct calcium channel blocker. Direct sodium channel blocker, no, it's also not a direct sodium channel blocker. Okay, so voltage gated sodium channel blocker that we have over the glutamate neurons agents are like voltage sodium channel blocker like phenytoin, lamotrigine, है ना, carbamazepine, okay, valproate, all these agents, है ना. N-type neuronal type calcium channel blocker over the same neuron, over the glutamate neuron, will be lamotrigine is having, plus drugs like tiagabine, gabapentin, pregabalin are the drugs that are N-type calcium channel blocker. Okay, N-type calcium channel blocker. एक तो है आपका lamotrigine, which is actually a voltage gated sodium, but additional activity is also N-type calcium channel blocker, plus other drugs like pregabalin, gabapentin, they are the N-type calcium channel blocker. Clear? So I believe कि इतना ठीक है. We'll take the next one. A patient presented with a history of psychosis and denying the injectable antipsychosis. You plan to start the patient on the sublingual agent. Which of the following is a recently approved atypical antipsychotic which can be given via sublingual route? So patient is denying any particular antipsychotic agent, injectable भी deny कर, तो अब आप sublingual दे दीजिए. कौन सा sublingual देंगे? एसिनापिन, risperidone, quetiapine, aripiprazole. With each of these drugs there has been question that has been asked. चारों टॉपिक्स पे चारों जो ड्रग दिए हुए चारों पे क्वेश्चन आए हुए. गो अहेड प्लीज. Which do you think is the correct one? Okay, that's good. That's good. So as I can see here, most of you are going correct only. Very nice. There are some other options that are also being marked. A, B, D. Okay, okay. So guys, sublingually available is esinapine. Esinapine is antipsychotic, atypical antipsychotic that is available by the sublingual route. Atypical antipsychotic that is sublingual route से it is available. Now risperidone, what is important points about risperidone that I want you to remember, all of you, that it's a risky drug. What do I ask you to remember? Risky drug. Why am I calling it as a risky drug? Because it's the most potent atypical antipsychotic. Most potent atypical antipsychotics, and because of that reason you should know it is also associated with extrapyramidal symptom and hyperprolactinemia among atypical. You see, atypicals are not supposed to cause extrapyramidal symptom. Atypicals are mainly associated with a metabolic syndrome or other side effect, है ना? But one atypical that can cause this side effect like extrapyramidal symptom will be your risky drug by the name of risperidone, है ना? तो मैं इसको इसलिए risky drug बोलता हूँ. Quetiapine, it's associated with metabolic side effect, वो तो है, plus it is also causing cataract, है ना? Aripiprazole, it is one atypical antipsychotic drug that is also having partial agonistic effect over the 5-HT receptor, plus it is usually associated with a less weight gain, less weight gain. It does not cause weight gain as compared to clozapine, olanzapine और quetiapine. तो तीनों पे क्वेश्चन पूछा हुआ है ना. Aripiprazole, ziprasidone, they cause very less weight gain or usually they are not associated with the weight gain as a side effect. ठीक है. The following side effect is seen due to which of the following drug? Acetazolamide, bimatoprost, pilocarpine, brimonidine. Go ahead, please. What do you see? I can give you a hint here that look at the size of the eyelashes. Look at the size of eyelashes. Is it acetazolamide? Is it bimatoprost? Is it pilocarpine? Is it brimonidine? Which drug will be causing this side effect? Acetazolamide. B, bimatoprost. Okay, very good, है ना. So PGF2 alpha analog that we have, PGF2 alpha analog, we know it is going to cause side effect like pigmentation of iris. And this pigmentation of iris in ophthalmology they actually call it as heterochromia iridis. Heterochromia iridis. ठीक है. They also cause growth of eyelashes, trichomegaly, growth of eyelashes that we can see in this patient. Drugs like latanoprost, bimatoprost, travoprost, tafluprost, they are a PGF2 alpha analog. I'm using my another phone here just to check your comments here, and I can see that most of you are actually correct here except few, those who are marking other option. Then they also causes foreign body sensation. They also cause fat atrophy of the orbit. You see, if there is a fat atrophy of the orbit, because of the fat atrophy of the orbit, there will be enophthalmos. So enophthalmos is another finding that has been noted with the PGF2 alpha analog, and it also causes development of the acute anterior uveitis. Studies have shown it can cause acute anterior uveitis. And why have I written in this order? Because the mnemonic of the side effect is PGF2 alpha only. PGF2 alpha is for A, PGF2 alpha. Yeah, PGF2 alpha. Alright, so I hope कि clear है ये growth of eyelashes है. Acetazolamide is one of the carbonic anhydrase inhibitor that is mainly preferred in mountain sickness. Acetazolamide is also the drug that causes mainly neuropathies. It can cause hepatotoxicity, it can also increase the risk of renal stone. So those are the side effects. Pilocarpine, one of the M3 receptor agonist, causing meiosis, and it is one such drug that increases the trabecular outflow. ध्यान रखिएगा, ये trabecular outflow को बढ़ाता है, trabecular outflow. And side effect, because it is also causing spasm of the ciliary muscle, so therefore they can cause broache, frontal headache, that is very frequently given complaint by the patient who is on pilocarpine. Apraclonidine, brimonidine, they are the alpha 2 agonist. That is going to cause side effect like sedation, alpha 2 agonist. So I hope कि इतना clear है. Bimatoprost is the correct answer for a question like this that happens with one of the PGF2 alpha analog. Currently, this PGF2 alpha analog is considered the drug of choice in any case of open angle glaucoma. However, if the examiner is asking you drug of choice for open angle glaucoma in India, we are more preferring timolol. Timolol is the drug of choice for open angle glaucoma in India, right? The cost is the main reason. Okay. Most powerful anti-glaucoma drug again PGF2 alpha analog, latanoprost, bimatoprost, travo, tafluprost. All right. The approved device Ocular is used for the delivery of which drug? Very easy, because if you look at the Ocular, it is in the shape of O only. Ocular is in the shape of O. Yes, Aarti, Pranam, very good evening doctors. Go ahead please. Ocular, I think pretty easy है ये भी, पहले बताया हुआ है. क्लोनिडीन, एट्रोपिन, पाइलोकार्पिन, प्रोप्रानोलॉल. यहाँ पे 2 आई हो गया बाय मिस्टेक. Go ahead, provide the answer. Clonidine is given via Ocular. Okay. Leo is selling D. Other students, बाकी सब लोग भी ट्राई करिए. C. Okay. C. Okay. Pilocarpine is the correct answer. Actually, Ocusert is actually used to deliver the pilocarpine. That is, we place it near the lower eyelid, and it will be causing continuous release of the pilocarpine, है ना? So Ocusert O shape में Ocusert याद रखिएगा, and this will be releasing pilocarpine, the one that is your M3 receptor agonist, and mainly utilized in the treatment of the glaucoma. ठीक है, not for atropine, clonidine or propranolol. Come on. A patient with history of manic episode followed by depression was started on drug which act on the prophylaxis against this problem. Which of the following agent is not used in this patient? So there is a manic patient followed by depression. So mania and depression दोनों आ रहा है, उस कंडीशन को क्या बोलेंगे, राइट? सोनू शर्मा, फार्माकोलॉजी फार्मेसी और एमबीबीएस का सेम होता है क्या? नहीं, सेम नहीं होता है, बिकॉज इन एमबीबीएस दे विल बी मेनली क्लिनिकल ओरिएंटेड, और ज़्यादा उसमें क्लिनिकल डिटेल से ही पढ़ाते हैं कंपेयर टू फार्मेसी में, वेयर मेनली यू विल हैव सब्जेक्ट अपार्ट फ्रॉम discussing the basic sciences, that is basic cardio, basic ANS, basic CNS, basic receptors and all will be same only, but ज़्यादा उसमें clinical touch नहीं होता है, ठीक है? प्लस उतना डिटेल में नहीं जाते हैं फार्मेसी में भी. सो दिस इज अ केस ऑफ बाइपोलर डिसऑर्डर. वेरी गुड, विच मोस्ट ऑफ यू आर मार्किंग. सो विच ऑफ द फॉलोइंग ड्रग इज नॉट यूज्ड इन दिस पेशेंट? इफ अ पेशेंट इज हैविंग बाइपोलर डिसऑर्डर, विच ऑफ द फॉलोइंग इज नॉट यूज्ड इन बाइपोलर डिसऑर्डर? कम ऑन, which drug is not used? Yes, very good, Achan Khan. Phenytoin is not used, right? Phenytoin is not used because, right, phenytoin has one thing, it is mainly having anti-arrhythmic property. The extra anti-epileptic uses, other than anti-epileptic, the non-epileptic uses are anti-arrhythmic property. It has anti-arrhythmic property. I'm talking about the phenytoin. Others can be used. Valproate, in fact, considered the drug of choice in a patient with the rapid cycler. Yes, doctor, you can say, Dr. Sonu, है ना? Because mainly उसमें जो other subjects हैं उसमें drug production and बाकी सारी details ज़्यादा पढ़ाई जाती हैं. Okay. Drug of choice for rapid cycler, topiramate can also be used. Atypical antipsychotics, it is mainly preferred in pregnant females, pregnant patients, right? Because pregnancy में lithium is mainly associated with your teratogenic effect like Epstein anomaly. A patient with major depression started on agent which increases the level of serotonin and noradrenaline. Which of the following drug has this property? So come on, it's also a very simple question, but given in a case-based scenario. A patient with major depression, the drug is going to increase the level of serotonin and noradrenaline. Which of the following drug has this property? That's very good, Dr. Sonu. Even if you are also doing, that's very nice. You will have lots of benefit of pharmacy that you have done. Yes, that's right. So we'll proceed with this question. Which drug is mainly, we are talking about which is a SNRI, which is a serotonin noradrenaline reuptake inhibitor. Is it amitriptyline? What is amitriptyline? Amitriptyline is one of the tricyclic antidepressant. Clomipramine, also a tricyclic antidepressant. Imipramine, also a tricyclic antidepressant. So the only one that we are left with is a venlafaxine. I used to tell you one mnemonic in the classes, then SNRI is going to increase the level of serotonin and also it is going to increase the level of noradrenaline because it is serotonin noradrenaline reuptake inhibitor, right? So the drugs that I used to give you is venlafaxine and one of the congener of the venlafaxine by the name of your desvenlafaxine. Venlafaxine and desvenlafaxine. Then we have other drugs like duloxetine, milnacipran, and other one is known as your levomilnacipran. You see, very easy to remember all of them. I used to give you this very simple mnemonic like, if you are trying vanilla, venlafaxine sounds like the vanilla ice cream. You try vanilla, it will dual your love. So remember the mnemonic, वेनिला डुअल्स माई लव, ट्राई करिएगा, डुअल मतलब दो न्यूरोट्रांसमीटर के लेवल को बढ़ा रहा है ना, सो वेरी इजी टू रिमेंबर, वेनिला इट डुअल्स माई लव, राइट, वेनिला डुअल्स माई लव, इससे बेहतर क्या होगा, राइट, venlafaxine is a drug, and remember too much of vanilla will be toxic, especially to your heart. So at a high dose venlafaxine, at a high dose venlafaxine can produce cardiotoxicity, not at the therapeutic dose, only venlafaxine at the high dose, ठीक है, others are not cardiotoxic, there is no report of cardiotoxicity by the others. Okay, duloxetine is recently approved, also recently it's also an FDA approved agent for fibromyalgia. Apart from being used in depression, recently it's also approved agent for the fibromyalgia. All right, so other drugs in this class is simply tricyclic antidepressants, vanilla duals my love, or the SNRI. Multiple time repeated question, you had just had to identify which is an SSRI, which is a SNRI, which is a TCA. Okay, next question. In a patient with the Parkinson disease, carbidopa is useful in the treatment because, why is carbidopa useful? It's a precursor of levodopa. It's a dopamine receptor agonist. Prevents peripheral biotransformation of the L-dopa. It prevents the breakdown of the dopamine. You see, this type of question has been asked in the past. Okay? What is the rationale behind adding carbidopa with levodopa? What is the advantage of adding carbidopa with levodopa? This type of question examiner has given already. So what's your answer? Is it a precursor of levodopa? No, not right. Right? Very good. Most of you are giving the correct one, that it prevents the peripheral biotransformation of levodopa. That's very good. So that more and more dopamine could be available to the brain. That is why we are using carbidopa. Remember, carbidopa, it's mainly a peripheral dopa decarboxylase inhibitor. Peripheral dopa decarboxylase inhibitor. All right, very good. Peripheral dopa decarboxylase inhibitor is carbidopa. There is one more, benserazide, less commonly used. It is a carbidopa that is very commonly used along with the levodopa. In fact, levodopa is not used alone. Levodopa, carbidopa are given in a fixed dose combination. Okay, that's very nice. Next one, in a patient with the vague lower abdominal pain and few के बाद कुछ नहीं है, in a patient with the vague lower abdominal pain, drug of choice for bladder cancer. Okay, इसमें ये few other symptom like hematuria, right, hematuria were noted. ठीक है, ये एक्चुअली ये पूरा केस आई मिस टू टाइप, आई गेस ये somehow डिलीट हो गया है, तो इसको लिख लीजिए. ये क्वेश्चन ऐसे, a patient presented with a vague lower abdominal pain and other symptom like hematuria was noted and it was diagnosed with the bladder cancer. ठीक है, तो केस बेस्ड सिनारियो आया कि डायग्नोसिस किया कि दिस इज अ केस ऑफ ब्लैडर कैंसर, which of the following is considered the drug of choice? Cyclophosphamide, ifosfamide, cisplatin, procarbazine. Go ahead please. The case I have given you a full scenario, presentation, vague lower abdominal pain and hematuria. What is the drug of choice? If the diagnosis that was made was of bladder cancer. Other students, please try. Is it cyclophosphamide, ifosfamide, cisplatin, procarbazine? Yes. So I think I am getting the correct answer already. Cisplatin happens to be the drug of choice among the platinum compounds. Cisplatin, guys, it is the drug of choice in many cancer, like head and neck cancer. Yes, it is the drug of choice. In upper GI cancer, yes, it is the drug of choice, right? Upper GI cancer like esophageal cancer, right? Gastric cancer, right? It's also drug of choice in a patient with the cholangiocarcinoma. ठीक है, cholangiocarcinoma. Then it is also considered the drug of choice in patient with the genitourinary carcinoma. Genitourinary, that contain many organs like bladder. Yes, for bladder cancer it's the drug of choice. Transitional cell carcinoma. Then it is also considered the drug of choice in cervical cancer, ovarian cancer. Also the drug of choice in a patient with the testicular cancer. So in all of them it can be used as a drug of choice. In multiple conditions it is used as a drug of choice. So one of them will be cisplatin. Now about cyclophosphamide and ifosfamide, you should know that one of their metabolite, this is a drug that is used in multiple cancer. Cyclophosphamide, ifosfamide, that we have like we can use them in Hodgkin lymphoma, non-Hodgkin's lymphoma, you know, plus they are also used in multiple other cancer that we have, like, you know, ovarian cancer वगैरह में it can be used, है ना. One of their metabolite is known as your acrolein, and this acrolein is actually toxic to bladder. Acrolein causes a side effect known as your hemorrhagic cystitis. Then anti-cancer drug that is causing hemorrhagic cystitis, and this patient can also present to you with the hematuria or bladder fibrosis. Okay, so hemorrhagic cystitis इसका side effect है, and to prevent this side effect we are going to give IV mesna. ठीक है, IV mesna. Reduce cause, it causes cross linking of the DNA, therefore it will be forming an abnormal DNA, and that abnormal DNA will be caught at the checkpoint. I repeat again, alkylating agent and platinum compound, they actually causes DNA cross linking. Usually adenine, guanine, जो purine और pyrimidine का जो cross linking है normal से, it will be causing abnormal cross linking. ठीक है, and that abnormal cross linking will be producing an abnormal DNA. That abnormal DNA will be caught at the checkpoint that we have, like G1S, G2M checkpoint. ठीक है, जो checkpoint हमारे हैं वो checkpoint पे it will be caught, ना. So since it is causing cross linking, that is the main mechanism of action. I hope it is making sense. Reduce cost, as your name says. ठीक है. A monoclonal antibody, also called anti-angiogenesis agent, used in metastatic colorectal carcinoma is trastuzumab, rituximab, bevacizumab, cetuximab. Go ahead, please. All of these are very, very high yield question. Very, very high yield question. It has been asked, or it could be upcoming question in your exam. I mean the topic that I have chosen here is very, very high yield topic. Okay, so which monoclonal antibody? I think most of you are marking it correctly. Very well. So bevacizumab is the correct one. The one that is acting in the circulation, guys, is bevacizumab. It is one of the anti-VEGF monoclonal antibody. Anti-VEGF monoclonal antibody that is used mainly in proliferative diabetic retinopathy, and it can also be used in the colorectal carcinoma. ठीक. There is one anti-genesis. One is bevacizumab and ranibizumab. These are the humanized monoclonal antibody. ठीक है. Similar to CI, we have one more by the name of abciximab. It's also one of the chimeric monoclonal antibody that is having GP2B 3A inhibiting property. It's one of the antiplatelet drug. It is one of the antiplatelet drug. It's one of the antiplatelet. Okay. Drug of choice for akathisia: lithium, fluoxetine, propranolol, haloperidol. Go ahead, please. What do you think is a possible drug of choice for akathisia? Is it lithium? Is it fluoxetine? Is it propranolol? Is it haloperidol? Very easy question. Akathisia, I'll tell you two things. One is it's one of the extrapyramidal symptom. In fact, it is the most common type of extrapyramidal symptom. Most common type of extrapyramidal symptom. Okay, most common extrapyramidal symptom, and the drug of choice for that will be your propranolol, not any other drug. Most common type. Haloperidol will never be drug of choice. Come on, D इसका ही लोग मार रहे हैं ना. D, how can haloperidol? Haloperidol, it is the most common drug causing extrapyramidal symptom, है ना. Most notorious drug to cause extrapyramidal symptom. It's a high potency typical antipsychotics. So this extrapyramidal symptom is mostly associated with typical antipsychotics. ठीक है, typical antipsychotics which are mainly your D2 receptor blocker. ठीक है, D2 receptor blockers. Clear है? तो ये है आपकी तैयारी इस लेवल की होनी चाहिए. When you see the question, है ना. Try to think about the notes में जो भी दिखाया ना, whatever we have given you, try to think about that. Mannitol is contraindicated in which scenario, and why is it contraindicated? You should know the reason also. Is it contraindicated in angle closure glaucoma, acute renal failure, cerebral bleed, raised intracranial pressure? Mannitol. Which kind of drug is it? What is the site of action? Site of action, it can act at almost all site of nephron, all site of the nephron, but predominantly it is acting at the PCT, proximal converter tubule, and loop of Henle. Which kind of diuretic is it? Mannitol. Yes, most of you are marking C. There are other students those are marking D as well. Can you tell me which kind of diuretic is mannitol? I think it's pretty simple and very simple logic that you should have. Plasma volume expander. What will you call that? Plasma volume expander. उसको किस diuretic class में रखा गया है? Anyone who remember that? There are students acute renal failure. Osmotic diuretic की class में रखा गया. Very good. Osmotic diuretic, right? Osmotic diuretic. It is usually contraindicated in a patient with the active cerebral bleed. अगर cerebral bleed हो रहा है तो we should not be using that. In a patient with cerebral bleed, active cerebral bleed, we should not be using that because they are osmotic diuretic. And as I have told you already, any osmotic diuretic, what they are going to do, they will be pulling the blood toward themselves. So wherever they go, they try to pull the blood towards themselves. So for example, if there is a blood vessel and if there is a rupture of the blood vessel, the bleed is there inside the brain, parenchyma, and if the drug is also going, right, wherever they go, they are always and always pulling the fluid, the blood towards themselves, and they can always and always worsen this cerebral edema, or they can not cerebral edema but the cerebral bleed, they can always and always worsen the bleed, or the blood that is present inside the brain parenchyma will always increase due to the osmotic diuretic if there is active cerebral bleed. Alright, it does not directly cause active cerebral bleed, remember. Actually अगर वो ischemic stroke होता तो in that we would use raised ICP, that is mainly due to ischemic stroke, we can use that. But if there is active cerebral bleed, we should not use that. ठीक है. In angle closure glaucoma, it is the preferred drug. ठीक है. We try to decrease the intraocular pressure as well. True about thiazide diuretics. Go ahead. Tell me one true statement about the thiazide diuretics. One true statement about thiazide diuretics among the four. Weak and short acting, can derange lipid profile and increase uric acid. On the basis of option B, one question has been asked already in NEET PG 2020. Act by blocking NAK2Cl channel, can cause hyperkalemia and hypernatremia. अगर एक्टिव ब्लीड है तो वी वुड नॉट बी, अगर ब्लीड का एक्टिव ब्लीड है या एक्यूट ब्लीड है तो वी वुड अवॉइड दैट एज मच एज वी कैन. डॉक्टर फरहान, मोहम्मद फरहान, है ना. वी विल लुक फॉर द अदर ऑप्शन, कैल्शियम चैनल ब्लॉकर्स, है ना, लाइक निमोडिपिन वगैरह. वी विल लुक सी, मोस्ट ऑफ यू NAK2Cl blocker, very good. Thiazide diuretics, come on. It is one of the NaCl blocker, NaCl co-transporter inhibitor at the early part of DCT. ये early और late पे भी क्वेश्चन पूछा हुआ, early part of DCT. So I think मैंने already option C को मैंने rule out कर दिया. For all the students those who are going ahead with option C, sorry I broke your heart, but I had no other option because you guys were marking wrong. Other option please. Other students now. All right. So ये तो rule out हो गया. It can cause hyperkalemia. It's a diuretic, no. So it will never be causing hyperkalemia or hypernatremia. They are going to cause hypokalemia or hyponatremia. Hypokalemia or hyponatremia. That is one thing. They are slow acting diuretic. but long acting, slow है ना, but not short acting, they are long acting diuretic, they are long acting diuretic. ठीक है, thiazide diuretics are the long acting, that is why they are preferred in the hypertension के management में, but it is said that they can derange the lipid profile and increase the uric acid as well. So examiner asked in 2020, as I was telling you, that which of the following, in a patient presented to you with a history of gout, serum uric acid level is 9 or 10 that has been given, which of the following anti-hypertensive drug would be contraindicated? Answer was thiazide diuretics. Clear hai? Thiazide diuretics will be correct answer for a question like this. All right, so B is the correct answer. It will derange the lipid profile and increase the uric acid. That is why it is also contraindicated in a gout patient. That was the question. Corneal microdeposits is a known side effect of chloroquine, chlorpromazine, quetiapine, amiodarone. Go ahead, please. Corneal microdeposits is a known side effect of the microdeposits over the cornea is more commonly, or among the given choices, is given with the amiodarone. But studies have shown that yes, with the chlorpromazine also they can be seen. So I would be saying D more than B. Chlorpromazine के साथ भी corneal deposition has been noted. But the term that has been written here, microdeposits, this term has been given especially with the amiodarone. ठीक है? Chlorpromazine also causes corneal deposition. ठीक है? इसको vortex keratopathy भी बोलते हैं, vortex keratopathy भी बोलते हैं. ठीक है, vortex. Now chloroquine or hydroxychloroquine, it mainly causes what? Bullseye maculopathy. Farhan, listen to me. Bullseye maculopathy is something that will be caused by this. This macula is present on the retina, no? Bullseye maculopathy, macula is present on the retina. So retinopathy or maculopathy will be caused by this. It is not associated mainly with the microdeposits. अगर आपको एक चुनना हो तो we will be proceeding with the D. ठीक है, quetiapine that we are having, it is actually associated with the cataract, right? A cataract more commonly. Cataract के साथ इसकी ज़्यादा रिस्क ज़्यादा साइड इफेक्ट मिले हैं कैटरैक्ट ना. क्यूटियापिन, सो मैं निमोनिक बताता हूँ. अंधी रानी क्वीन अंधी थी, है ना, कैटरैक्ट. Quetiapine also causes priapism, painful prolonged erection, another side effect. Okay. True about ivabradine. Ivabradine that is used in a patient. Which of the following statement is true? Fast sodium channel blocker, slow calcium channel blocker, used to treat bradycardia, can cause tubular vision. So there are multiple options here. Which of the following option is a true actually about ivabradine? Go ahead, please. Start your answers. What is true about ivabradine? A couple of questions more, then we are done here. Anuradha Gupta is A. Okay. It's an anti-hypertension. Okay. ivabradine. ध्यान दीजिएगा, नाम में ही है, इट्स अ ब्रेडिकार्डिया इंड्यूसिंग ड्रग. It's a bradycardia inducing drug. They themselves causes bradycardia. So how can you use it for the treatment of the bradycardia? They are used for the treatment of tachycardia. Yes, not for bradycardia. So ये option तो rule out हो गया. Yes, very good, Farhan. Ivabradine is one of the IF blocker, that is funny current blocker, the prepotential sodium channel blocker, that is known as your slow sodium channel blocker, pre-potential sodium channel blocker. It's not a fast sodium, it's a slow sodium channel blocker. It's not a calcium channel blocker as well, है ना. Ivabradine, remember eva vision, vi देखिए लिखा हुआ ना, vi vision. So the mainly decrease the visual acuity, है ना. So visual acuity या vision को ये affect कर सकते हैं. Ivabradine, remember they are mainly having, they decrease the visual acuity, है ना. Visual acuity को ये कम करते हैं. Vision को ज़्यादा they are going to affect, not the fast sodium channel blocker. No, they are the slow sodium influx inhibitor, also known as a funny current blocker. The pre-potential slow sodium influx that is bringing the bringing it to the threshold limit. Okay. So T is the correct answer. Aarti, D. Not used to treat bradycardia, है ना. Tachycardia के लिए यूज कर सकते हैं, और it can be used यूज इसका मैं बता दे रहा हूँ. इट कैन बी यूज मेनली इन एंजाइना के लिए अप्रूव हुआ है. कैन ऑल्सो बी यूज इन एरिथमिया. ठीक है, एरिथमिया में भी मिसलेनियस ड्रग के फॉर्म में वी कैन यूज बिकॉज दे देमसेल्फ आर कॉजिंग ब्रेडिकार्डिया. व्हाट इज ग्लार्जीन? लॉन्ग एक्टिंग इंसुलिन, अल्ट्रा लॉन्ग एक्टिंग इंसुलिन, इंटरमीडिएट एक्टिंग इंसुलिन और शॉर्ट एक्टिंग इंसुलिन. व्हाट इज ग्लार्जीन? गो अहेड प्लीज. लॉन्ग एक्टिंग, अल्ट्रा लॉन्ग एक्टिंग, देखिए मैं सिंपल बोलता हूं, अल्ट्रा लॉन्ग एक्टिंग याद करना हो. अल्ट्रा लॉन्ग एक्टिंग, देयर ऑनसेट ऑफ एक्शन दैट वी हैव इज अराउंड 4 to 6 आवर में ऑनसेट ऑफ एक्शन, एंड ड्यूरेशन ऑफ एक्शन दैट दे हैव, इट कैन लास्ट अप टू 24 to 42 आवर. ठीक है. द ड्रग्स इन दिस वन इज योर ग्लार्जीन और डेटेमीर and D-glutic. So I used to tell you something that जो large acting है ग्लार्जीन है, और जो देर तक चले वो डेटेमीर और डेग्लूडेक है. वन इज ग्लार्जीन लार्ज एक्टिंग, लॉन्ग एक्टिंग याद कर लीजिए, और जो देर तक चले वो डेटेमीर और डेग्लूडेक है. So it is ultra long acting drug, है ना. ultra long acting drug, the correct answer that we are having, very good Dr. Anuradha and all the other students, it is B, right? It is B. Onset of action almost same है सबका. Duration of action, this will be the longest acting will be up to 42 hours. सबसे ज्यादा लॉन्ग एक्टिंग कौन है? दैट इज डी-ग्लूडेक. सबसे देर तक चलेगा, देर और देर तक चलेगा, दैट विल बी डी-ग्लूडेक. एंड दे आर ऑल्सो कंसिडर द पीकलेस इंसुलिन. The ultra long acting are considered the peakless insulin. They will be achieving peak at a very very high dose. Remember, this ultra long acting insulin you should not be using in acute scenario. First thing, their onset of action is very slow. Second thing, the hypoglycemic effect will be for long time. ठीक है, so acute में कभी इसको prefer नहीं करते. Clear? Mechanism of action of teneligliptin. Very very simple question, yet could be a very potential MCQ for your examination. What is teneligliptin? Aldose reductase or alpha glucose, aldose reductase or alpha aldose reductase, SGLT2, DPP4, recombinant GLP1 analog. Go ahead. There is one more enzyme similar to aldose, is alpha glucosidase, that is mainly acting in the intestine. Alpha glucosidase, है ना. So वो alpha glucosidase inhibitor तो होता है. Drugs like your acarbose, voglibose, miglitol, ये अलग ड्रग होते हैं. ठीक है. Now teneligliptin is what? They are all gliptins, and we all know all the gliptins are mainly DPP4 inhibitor. Very good, है ना. So GLP, glucagon linked peptide, they are mainly associated. They are mainly going to act at the level of the pancreas. They are mainly acting at the level of pancreas. And by acting at the level of pancreas, what they are going to cause is GLP-1 insulin release. They also causes your amylin release. ठीक है, इंसुलिन का रिलीज कराते हैं फ्रॉम द बीटा सेल ऑफ द पैंक्रियास. बीटा सेल से इंसुलिन का रिलीज करेंगे. बट द प्रॉब्लम इज लाइक एनी अदर पेप्टाइड, दे आर ऑल्सो वेरी शॉर्ट लिविंग पेप्टाइड. दे आर रैपिडली मेटाबोलाइज्ड बाई DPP4. DPP4 से ये मेटाबोलाइज होते हैं. Now GLP-1 is helpful for our body because it is causing release of the insulin. This is exactly what we want. But if DPP4 is the villain which is actually inhibiting GLP-1, what we should do, we should actually inhibit DPP4. All the gliptins, all the gliptin like sitagliptin, saxagliptin, linagliptin, alogliptin, vildagliptin, teneligliptin, they are all DPP4 inhibitor. Gliptin से याद कर लीजिए, ठीक है. Another question that has been asked in this one is on the basis of the linagliptin, that is mainly excreted via hepatic route, excreted via liver या hepatic route से याद करिए liver है ना. Linagliptin, that is why they are considered safe in the renal failure patient. यही क्वेश्चन आया हुआ था नीट पीजी और एम्स में. renal failure patients में they are the safer drug. Linagliptin liver से है इसलिए renal failure में they are safer. Okay. GLP-1 analog or recombinant GLP-1 analog that we have, drugs like your, इसका analog that we can use drugs like your liraglutide, lixisenatide, glutide वाले जो है lixisenatide और semaglutide, ऐसे करके जितने भी वो सारे के सारे GLP-1 analog है. SGLT2 inhibitor drugs like your canagliflozin, जिसके नाम में ग्लीफ्लोजिन आए है ना, canagliflozin, dapagliflozin है ना, empagliflozin, remogliflozin, evagliflozin, these are all the gliflozin. ठीक है. So knowing about this other options as well is equally important for you. Which of the following is orally acting antithrombin drug? Orally acting antithrombin. Okay. Pyridine, lepidolin, bivalirudin, dabigatran. So they are simply asking, see, prothrombin से thrombin बनता है. Thrombin is the one that is active, factor 2A. So which is orally active? They are direct thrombin inhibitor. Direct thrombin inhibitor. DIN is direct inhibitor. They are the direct 2A inhibitor. The root of them, सबके नाम में इन आ रहा है, याद कर लिए. Root of them they are all available injectable routes. Hirudin, lepidolin, bivalirudin, argatroban है ना, melagatran, they are all injectable. The only one which is available by the oral route है ना, that is oral route से dabigatran. Dab water is coconut water, याद कर लीजिए. Dab water is coconut water. So dabigatran is the orally available. ठीक है, orally available. Another question that the examiner asks, अगर इसकी overdose होती है, so what is the antidote that we can going to use? Dabigatran को overdose में आप दबा के दारू लीजिए, ऐसे याद कर लीजिए, इदारुसीजुमाब. तो बोलते हैं क्या, दबा के दारू है ना, इदारुसीजुमाब, मोनोक्लोनल एंटीबॉडी, dabigatran दबा के दारू, इदारुसीजुमाब. ठीक है, रिमेंबर दिस. क्लियर? So that will be your dabigatran. All right. Bisphosphonate act by, I think it's pretty simple one. Bisphosphonate कैसे काम करेगा बताइए? How will bisphosphonate act? Bisphosphonate is acting by go ahead please. Bisphosphonate is currently considered as, guys, remember, a drug of choice in a patient with the osteoporosis. It's also considered the drug of choice for osteoporosis in post-menopausal women. उसके लिए भी यही drug of choice है. In post-menopausal patients में भी also it's the drug of choice. Examiner asks what's the mechanism of action. So increasing the osteoid formation, increasing the mineralization of the osteoid, decreasing the osteoclast mediated resorption of the bone, decreasing the parathyroid hormone secretion. It does not decrease the parathyroid hormone secretion, it is mainly decreasing the osteoclast mediated resorption. So mainly we all know that whenever the osteoclast, the active osteoclast, these are the osteoclasts that we have, they are, whenever they are activated, they actually cause more resorption of the calcium from the bone, and they will be bringing that calcium to the circulation. Okay? Bone resorption is caused by osteoclast, that is going to cause hypercalcemia. These agents, they are simply going to help, they are simply going to deposit in the bone, and after that along with the calcium they will be taken inside, and once they are taken inside, they are going to actually promote the osteoclast का apoptosis. They are going to promote the osteoclastic apoptosis. So simply they are actually inhibiting the osteoclast. Osteoclast inhibition is the mechanism of action that you can remember for this bisphosphonate. Okay, bisphosphonate. Side effect पे question पूछता है. Side effect like your GERD, gastroesophageal reflux disease, lower esophageal irritation करा के GERD करा सकता है. That is why whenever you give this, ask the patient to maintain upright posture. GERD is one of the very common side effect. और osteonecrosis of the mandible, जिसको jaw necrosis भी बोलते हैं. Osteonecrosis of the mandible is other side effect that we have. इसको बोलते हैं jaw necrosis. Okay. Now a couple of more questions before we end the session today. Which of the following can cause pulmonary fibrosis? Methisargide, catanserin, ritanserin, saprogrelin. Go ahead, please. Which agent will be causing pulmonary fibrosis? The drugs among all of them that is associated with pulmonary fibrosis, guys, is methisargide. है ना? 5-HT2A blocker, methisargide causes pulmonary fibrosis. Which of the following antibiotic possesses additional anti-inflammatory and immunomodulatory property? Anti-inflammatory and immunomodulatory property. This is one of the PYQ question of NEET PG, right? Antimicrobial, that is possessing immunomodulatory property, that is macrolides. Now macrolides, erythromycin that we have, studies have shown they possess immunomodulatory property. Okay. Protein synthesis inhibitors showing bactericidal action. You see, protein synthesis inhibitors, they are usually bacteriostatic. They are not cidal, they are static. Which of the following protein synthesis inhibitor is having bactericidal property? Tetracycline, macrolides, aminoglycoside, chloramphenicol. Macrolides are static. Go ahead, please, for this question. Protein synthesis inhibitor, aminoglycoside, linezolid, streptogramins. They show cidal property. So among the given choices that we are having, aminoglycoside is the one that is having bactericidal property. It is having bactericidal property. Okay. Last question for the day. Riluzole is a recently approved drug for which of the following? Huntington disease, Parkinson disease, amyotrophic lateral sclerosis, Wilson disease. Riluzole. For this one, I'll give you a hint. There is one more drug that is approved in 2017, and Edaravone is the name of the agent. In fact, in the same year 2017, AIIMS has already asked this question. Edaravone. It's one of the drug that is having free radical scavenging property. Free radical scavenging property is seen with Edaravone. It's one of the small molecule with free radical scavenging property. It is also used same as Riluzole for the ALS, amyotrophic lateral sclerosis. The preferred chelating agent for Wilson disease, guys, is the D-penicillamine. ठीक है, D-penicillamine. Valbenazine can be used in Huntington's. Parkinson disease के लिए we will be using levodopa, carbidopa. ठीक है. So the drug Edaravone, it's approved by FDA in year 2017 only, and Riluzole, it's one of the drug that is having NMDA receptor blocking property. NMDA blocker, and also has kinase receptor blocking property. So it's one of the drug that is used. It was the first drug that was actually used for ALS, amyotrophic lateral sclerosis. It slows down the progression. It slows down the progression of the disease. All right. So that will be all. And part 1 of this session, that is a clinical based MCQ that we are discussing here, was discussed yesterday. So it's readily available. You just have to look under my profile, or just here only you can just look. अनअकैडमी के पेज पे आपको मिल जाएगा. लिंक भी ऑलरेडी दिया हुआ है ग्रुप में, so you guys can check the link out as well. ठीक है. Since the time is not permitting, we have done enough number of question yesterday और कल और आज में, है ना. We'll be doing in more number of question in the upcoming days, that is from 1 or 2 March. We'll be doing more number of question on the same platform. Okay, so I hope you guys understand the limitation of time that we have. So thank you very much for your presence and attendance and for participating actively in this session. पार्ट 1 में ज़्यादातर हम USMLE पैटर्न क्वेश्चन किए हैं, ऑल न्यू क्वेश्चंस हैं. टुडे सेशन में वी हैड फ्यू PYQ सेशन, यू नो, PYQ एज वेल, बट कल जो किया था उसमें सारे के सारे नए हैं. आप एक बार ट्राई करिए, you will enjoy those questions as well. They're all clinical based questions. Okay, thank you very much guys, and I hope to see you in upcoming sessions. Have a good night to all of you. Any questions, you can post the question now, or you can just post the question in any of the platform that we have, and I would be more than happy to reply to all of you guys. Okay, chalo, bye bye to all of you. Have a good night.